Hello and welcome to my YouTube channel. Today I welcome you all to the second part of the previous video on career in psychology. Let's look at the career as a clinical psychologist in India. Let's dive into the video.
A career as a clinical psychologist can be very rewarding. Clinical psychologists work directly with clients in clinical settings like hospitals, outpatient clinics, treatment facilities, or private practices. Clinical psychologists diagnose and treat mental illnesses. We will try to understand the educational path that is required to become a clinical psychologist in India. For becoming a clinical psychologist, a licensed practitioner, you need to have a bachelor's degree in psychology. It is not must, but it is suggested to have one. It is okay if you don't have psychology in your bachelor's, but you need to have a BA or BSc degree at least. A BCom degree won't work. Then after your bachelor's, you need a master's degree in psychology. It can be any subfield, but mostly for becoming a clinical psychologist or neuropsychologist, you need to have your master's in clinical psychology, and for becoming clinical neuropsychologist, you need your master's degree in neuropsychology. This subfield is recommended, but it is not compulsory. You can have counseling psychology in your master's and still go ahead and become a clinical psychologist. After your master's, after your master's, you must pursue your MPhil in clinical psychology from an RCI licensed institute, wherein you will get trained in depth. After completing your MPhil degree in clinical psychology, you can practice as a clinical psychologist in India. Remember that without an MPhil degree in clinical psychology, you cannot practice as a clinical psychologist and neither as a clinical neuropsychologist. As many of us are interested in working in clinical setting, but not everyone is willing to spend 2 years of gaining rigorous clinical psychological training. And many of you might not be aware that after knowing that there is a lack of labor and to fulfill the need for the clinical psychologist, RCI has started a course named Professional Diploma in Clinical Psychology, wherein you will get this diploma in 1 year, and you can practice and will be addressed as an associate clinical psychologist. Now let's try to understand the area of work or expertise of a clinical psychologist. As we all know that a clinical psychologist is trained to assess, diagnose and treat mental health disorders and also psychological issues. A clinical psychologist might specialize in specific population including children, adolescents or adults, etc. Or they might focus particularly on a specific disorder, example anxiety, depression or eating disorder. They often work directly with the clients and patients, providing them therapy and counseling services to help the individual improve their mental well-being. They typically work in settings such as private practices, have their own private clinics, or they might work in someone else's mental health clinics, or they might work in hospitals, specifically psychiatry department, or they might work in academic institution where they work as a professor for a clinical either MPhil program or master's program. Other than that, a clinical psychologist may also conduct research on psychological interventions and contribute to the development of evidence-based treatment approaches. Now let's take some questions that were asked to me related to the field of clinical psychology. The first question is, can I become clinical psychologist if I have masters in counseling or industrial or forensic psychology? So yes, you can. If you do get your MPhil degree in clinical psychology, after doing your MPhil degree in clinical psychology, you can practice as a clinical psychologist. Even if you have your masters in counseling, industrial or forensic psychology, you can pursue your MPhil degree. But it is suggested to have clinical psychology in your masters as it gives you a good foundation. The next question is, how do I become neuropsychologist or forensic psychologist? So for the first part, to become a neuropsychologist, you need to gain same degree as that for a clinical psychologist. that is your MPhil degree in clinical psychology. To practice as a clinical neuropsychologist, you need to have your MPhil degree in clinical psychology, and before that, you need to have your master's degree in neuropsychology. For forensic psychologist, to become a forensic psychologist, you can do your master's degree in forensic psychology. There are many universities that offer master's degree in forensic psychology. So you can pursue that, and then after your master's, you can gain some experience in that particular field, and then practice as a forensic psychologist. So the next question was, can you do your master's in clinical psychology and still become neuropsychologist? So yes, you can, but to practice as a neuropsychologist or clinical neuropsychologist, you need to have some experience in neuropsychology. So if you don't have your master's in neuropsychology, you won't be having any experience in neuropsychology or any educational background in neuropsychology. Although MPhil degree does have in their syllabus as one paper on neuropsychology, but only that particular degree won't give you the knowledge of becoming a neuropsychologist. After pursuing your MPhil degree, you might get your PsyD degree or PhD degree in with the focus of neuropsychology, and then you can work as a neuropsychologist. Or the other path is that you can do your master's degree in neuropsychology, then gain your MPhil degree in clinical psychology, and then practice as a clinical neuropsychologist. Since you have experience, or since you have knowledge of neuropsychology in your master's, an additional PhD or PsyD degree is not necessary, but you can definitely go ahead and do your PsyD or PhD ahead. The next question is bachelor's in psychology necessary for taking admission? Uh, no, bachelor's degree in psychology particularly is not necessary to take admission in your master's degree in psychology. Even if you have BSc degree with no psychology subject or BA degree with no psychology subject, you can take admission. Only the criteria is that you need to have a bachelor's in arts or bachelor's in science degree in your bachelor's. BCom or commerce degree in your bachelor's won't work because the eligibility criteria for taking admission in masters in psychology in any university or any institute is that of a BA or BSc degree. The next question is, can I become psychologist if I don't have psychology in 12th grade? So yes, you can become a psychologist even if you don't have your psychology in 12th grade, or you are not from arts background, you are from science or commerce background. But in your bachelor's degree, you need to take your arts or science degree. The next is, can I become psychologist if I don't have psychology in bachelor's? Yes, you can take admission into master's degree program with no psychology in your bachelor's degree. Even if you have science, BSc or BA degree with no psychology subject as psychology as one of the subjects, you can still apply for admissions in master's program in many universities. Although there might be some universities that might keep their eligibility criteria for master's admission as psychology should be one of the subjects in your bachelor's degree. So you need to just check that before taking admissions. So that's it from my side. I hope this video was helpful to you guys and I could give you some insights into the educational path of psychology. If you have any questions, do comment and also like, share this video with your friends and family. And don't forget to subscribe to my channel for getting updated about this field. Thank you.